What's going on, world? Welcome. Hey, you guys already know what the deal is. We are doing NCLEX questions today. Today is Monday. Monday. What's up? How are y'all doing? What is this in my hair? I don't know what that is. Probably hair gel. Anyways, hey, what's the deal? What's up, y'all? We're going to be doing NCLEX questions today. Welcome. Hey, I know I'm a little bit late. But hey, sometimes there's things that we got to do. All right, you guys already know y'all already know what the prerequisites are around here. All right, I need 1,000 likes and I need 100 people up in here. We don't go nowhere until I get all of those. But of course, I want for y'all to do that. I want y'all to do your thing. What's up, Anastasia, Miss Ma'am? How are you? Here we go. Gray hair. That ain't gray hair. It's just there's some gray hair in here. Hey, don't do that. Don't do that. All right. No, but hey, I don't know. Anyways, you already know what to do. Hey, I want to know who you are, where you're from, and where you're at in your nursing journey. If you guys are new here, my name is Kevin. I go by the boot nurse. I've been a nurse for 3.5 years. I've worked ICU, OR, and PACU. I was in the military for 16 years. That's a little bit about me. But of course, I want to know about you. Swastika, hi, how are you? Doing pretty good, just hanging out. Shout out to you. What's up, Chan? How are you? Hey, you guys keep smashing that like button, share, follow. Hey, we got questions that are going on here today. I actually jumped into Nurse Nurse Meg. I saw her review earlier. She's pretty good. I like her. She's really nice. Hey, just because we're out here and we're nurses and we do all this stuff and we see what everybody else does, doesn't mean we hate on each other, y'all. Some people are just like, so-and-so's better. I mean, as a consumer, you can do that, but it's just like, you can. Y'all saying that stuff about whoever is better than some people are just other people's cups of tea. But Nurse Meg, I sat there and I like her. I like her stuff. So just like people say, hey, they like my stuff. To each their own, right? Yeah, she is. I love her. She's pretty cool, right? We nurses rock. That's what I'm saying. Everybody love everybody. Just because y'all aren't there yet, competition, y'all can do and say what you want. Hey, we're at 1,000 likes. I need another 20 something people up in here so we can go. Valletta, you passed your NCLEX, y'all. Ladies and gentlemen, smash the like button. Tell Valletta right now how much you appreciate her. Valletta, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. Ma'am, if there's one piece of advice you could give to everybody here, what would it be in regards to taking your NCLEX? Something positive and, something realistic. But once again, ma'am, congratulations to you and welcome to being a nurse. Congratulations. Welcome to being a nurse. Ladies and gentlemen, you guys know what we're doing. We're doing NCLEX questions. Hey, we'll call this the lightning round because we're going to go fast. You better keep up and you better answer. Participation is the key. So here we go in 3, 2, and question number 1. Don't doubt yourself. Facts. Do not doubt yourself. What's up, Ebony? Here we go. Question number 1. A patient with Parkinson's disease has a nursing diagnosis of impaired physical mobility related to neuromuscular impairment. You observe a nursing assistant performing all of these actions. For which action must you intervene? All right. So which action do you need to intervene on? Is the nurse assistant assists the patient to ambulate to the bathroom and back to the bed. The NA reminds the patient not to look at his feet when he is walking. The NA performs the patient's complete bed and oral care, or the NA sets up the patient's tray and encourages the patient to feed himself. What are we thinking? Ladies and gentlemen, welcome. We're doing NCLEX questions today here on this Monday, this beautiful Monday. Hope everybody had a great and safe weekend. I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you smash that like button. You guys share, you guys follow. We're on the road to 10,000 likes. If I get to question 10 and we don't have 10,000 likes, I guess that's all y'all getting today. Y'all just only getting 10 questions. So make sure y'all smash that. Hey, get carpal tunnel. Stop playing games. Chicago, you graduate in December. Shout out to you. Congratulations. Almost. Hey, before you know it, you'll be there. All right. Ohio, shout out to Ohio. Here we go in 3, 2, and the answer is C. The NA or nursing assistant performs the patient's complete bed, bath, and oral care. The nursing assistant should assist the patient with morning care as needed, but the goal is to keep this patient as independent and mobile as possible. That is part of management of care, which is the largest section on the NCLEX exam at 18 to 23%. Largest section on the NCLEX exam. Remember, Management of care consists of assignment, delegation, supervision. I, as the RN, can assign a nursing assistant to do those specific tasks because it's within their scope of practice, okay? You got to know what people can do, what they can and can't do, what they can and cannot accept. Same thing with LPNs. They need to know what their role is and what they can and can't do and can and can't accept. So management of care, make sure you guys understand that. That's part of the nurses NCLEX test plan. I'm just saying. Understand it. Been an RN for 12 years. Shout out to you. Here we go. Question number 12. Number 12. Question 2. The nurse is preparing to discharge a patient with chronic low back pain. Which statement by the patient indicates that additional teaching is needed? So the patient didn't understand what we were saying. So now we got to rope them back in so we can make sure that they're picking up what I'm putting down. Okay. Is that I will avoid exercise because the pain gets worse. I will use heat or ice to help control the pain. I will wear high heel shoes at home or at work. I will purchase a firm mattress to replace my old one. What are we thinking? Who passed? Whoa, somebody passed? Did I miss something? Hold on. No. I think Valletta was the only one that told me that she passed. So shout out to y'all. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. All right, but make sure you guys keep smashing that like button. You guys share and you guys follow. All right, I'm gonna give you guys 10 more seconds. We got some A's, we got B's. We got a bunch of people saying A. Okay, got a B, right? Okay. What else we got? A or C? You got to give me one. Jasmine, thank you for the heart. I appreciate you. Here we go. The girl next door says A. All right, here we go, y'all. Let's see. Love Nurses Labs. A care plan lifesaver. I'm going to talk about that here in a second, too. But here we go. Here's our answer in 3, 2. And the answer is A. I will avoid exercise because the pain gets worse. Exercises are used to strengthen the back, relieve pressure on compressed nerves, and protect the back from re-injury. Doing exercises to strengthen the lower back can help alleviate and prevent lower back pain. It can also strengthen the core, legs, and arm muscles. According to researchers, exercise also increases blood flow to the lower back area, which may reduce stiffness and speed up the healing process. That's part of health promotion and maintenance, which is 6 to 12% on the NCLEX exam based off of the 8 client needs sections. All right, so make sure you guys understand. If you don't, you need to circle back, get your content, do your questions and answers, read your rationales, because rationales help you retain the information that you are learning. All right. So shout out to everybody that got it right. If you got it wrong, you know what you need to do. Hope you're having a great day. Ma'am, I hope you're having a great day. Sarah, I love you. I see you in there. Thank you for the rose, Miss Ma'am. I appreciate you. All right, here we go. Question number 3. A patient with a spinal cord injury complains about a severe throbbing headache that suddenly started a short time ago. Now, there's the key. Started out of nowhere. All right, started out of nowhere. All right, assessment of the patient reveals increased blood pressure of 168/94 and a decreased heart rate of 48. Diaphoresis, which is sweating, flushing of the face and neck. What action should the nurse take first? So what is the very first thing that I need to do? All right, so do I want to administer the ordered acetaminophen, check the Foley catheter for kinks or obstruction, adjust the temperature in the patient's room, or notify the physician about the change in status? What are we thinking? Somebody said autonomic dysreflexia. Okay. I like where your head's at. Remember, on the exam, it is all about using critical thinking in order for you to make a clinical judgment. Right. And as nursing expands, because that's exactly what it's doing, you need to know more critical aspects of nursing to better care for our patient. Because there's certain things that you could do and you don't even have to call the physician. All right. What are we thinking? A bunch of people saying D. I had somebody in there, or a few people say B, or a bunch of people say B. So shout out to y'all. Nurseslabs.com is where I got these questions from. By the way, if you're one of those nursing students who needs help with care plans, they will save your life. It says, make sure you have all your information to provide the physician with, right? Because if you don't have your information, those physicians are going to start asking you tons of questions. And if you can't answer them, trust and believe me, that the conversation that you're going to have with that physician, it's not going to be a pleasant one. All right. It says assessment is already done. Call the doctor. All right. But the answer is check the Foley tube for kinks or obstruction. All right. These signs and symptoms are characteristic of autonomic dysreflexia. Shout out. Claire, did you say that? Shout out to you. A neurologic emergency that must be promptly treated to prevent a hypertensive stroke. The cause of the stroke is noxious stimuli, most often in distended bladder or constipation. So checking for poor catheter drainage, was it bladder distension and fecal impaction is the first action that should be taken. That is part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Hey, we're on the road to 50,000 followers. We're on the road to, I don't know, 100,000 likes, make that happen. And hey, ladies and gentlemen, that is a very key thing to look out for. One of the things that stick out is the spinal cord injury, and that all of a sudden they start having a spike in their blood pressure. All right. So that's just telling me body's not doing whatever it's supposed to be doing. Things are starting to get clotted off or kinked off because they can't feel down there. All right. Now they got a Foley catheter. Why is my bladder not draining? Why is poops not going anywhere? Right? Those are the things that you need to be looking out for. All right. So shout out to everybody that got that right. If you got it wrong, you know what you need to do. You need to circle back and you need to get that content and then, you need to circle back, get that content and hit right back to the drawing board. All right. Question number 4, which patient should you, as the charge nurse, assign to a new grad RN who is orienting to the neurologic unit? Okay. So here we go. Question A, is it a 28-year-old newly admitted client with a spinal cord injury, a 67-year-old patient with stroke 3 days ago and left-sided weakness, an 85-year-old dementia patient to be transferred to long-term care today, or a 54-year-old patient with Parkinson's who needs assistance with bathing? What are we thinking? What do we got? We got a bunch of people saying C. Okay. All right. So what is the key thing? It says, oh, Lord, NICU was a NICU nurse here. Completely useless for this question. That's okay, though. That's okay. And that's another thing that people need to realize in nursing. Just because you're a nurse doesn't mean that you know everything in every aspect of nursing, right? But on NCLEX, you need to have a good understanding of everything because it's all about providing good, safe patient care and making clinical judgments. Good, safe clinical judgments, okay? Says high possible. Okay. All right. Most stable patient. There you go. So they probably get the most stable patient, right? Because they're a new grad. All right. But here we go. And our answer in 3, 2, 1. And the answer is a 67-year-old patient with a stroke 3 days ago and left-sided weakness. The new grad RN who is orienting to the unit should be assigned stable, non-complex patients such as the patient with a stroke. Right. So think about it. The key thing that stuck out was for the fact that they had a stroke 3 days ago. This patient is no longer in the acute phase. Right now, it'd be different if it said, hey, they had a stroke an hour ago. They're in the acute phase. Right. So the key to that answer is that it was 3 days ago. All right. So those are the things that you have to be looking out for. Maybe you didn't get that answer or you didn't see the key terms that were in your question, so your answer gave you the answer. All right. So think about that. All right. Remember, they're considered acute when they're under 12 hours, right? So hey, anything after the 12 to 24 hour mark, boom. They're considered they're not considered to be unstable anymore at that point. All right. So shout out to all y'all that got that question right. And that's part of management of care, which is the first or the largest section on the NCLEX at 18 to 23%. So shout out to you. Shout out to my boy Kev for coaching me through NCLEX. I passed last week. My man, Antoine. Hey, if y'all don't know who Antoine is, Ugly Gang Twan, my man passed his NCLEX last week, got his results on Thursday. Welcome you, sir, to the greatest shit show on earth known as being a nurse. If there's one piece of advice that you could give to everybody out here, what advice would you give to everybody? And sir, once again, welcome to nursing. Here we go. Question number 5. A patient with a spinal cord injury at level C3 and 4 is being cared for in the emergency department. What is the priority assessment? What is the priority assessment for somebody who has a C3, C4 injury? All right, determine the level at which the client has impact sensation, assess the level at which the client or the patient has retained mobility, check blood pressure and pulse for signs of spinal shock, or monitor respiratory efforts and oxygen saturation levels. What are we thinking? My man says, stay consistent and stay focused. I love it. Somebody, what does it say? C3, 4, or 5, keep that diaphragm alive. Oh, Dr. Dan, I love the way you said that. I love the way you said that. I didn't say the answer. I'm just saying I love the way that you said that. So it says, I've got senioritis. You better get out of that senioritis. I hope you don't have senioritis when you go take that test. I take the test on Thursday. Shout out to you, Brittany. All right, y'all, 10 more seconds. Hey, we're on the road to 10,000 likes. 10,000 likes. Make sure you guys keep smashing that like button. You guys share and you guys follow. Hey, I'm almost to 50,000 1,000 followers, y'all. I need like 400 more followers. So let's make that happen. Get it out to the For You page. Here we go. Here's our answer in 3, 2. Jewel, thank you for the roses. I appreciate you. Thank you. And the answer is D, monitor respiratory effort and oxygen saturation levels. The first priority for the patient with a spinal cord injury is assessing respiratory patterns and ensuring an adequate airway. The patient has a high cervical injury, is at risk for respiratory compromise because the spinal nerves C3 to 5, innervate the phrenic nerve, which controls the diaphragm. Shout out to Dr. Dan with the, 3, 4, 5, keep the diaphragm alive, right? So that is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. So shout out to all of y'all that got that right. NCLEX on Wednesday, tips are welcome. Tomorrow is Tuesday, don't study, and you need to relax. That would be my tip to tell you. You're already more than prepared for this exam. All right. Already more than prepared for this exam. Ladies and gentlemen, hey, if you're taking the NCLEX, not on Wednesday, but if you're taking the NCLEX, I have some test taking tips for you to help you conquer the NCLEX. It's a free download. You guys can go over there and check it for yourself. 42 pages of anything from little keywords, how many questions are on the exam, how long you have it, key phrases and stuff like that to look out for. That's at thebootnurse.com/test. Make sure you guys go over there and check that out for yourself. And you guys can also find it linked in my bio. Brittany, you said you have it downloaded. Shout out to you. What do you think of it? Let people know in the chat what you think of it. But if you haven't gotten it, make sure you guys get over there and you guys get that. All right. So shout out to y'all. My man Jay is in the building, sir. I appreciate you being here. If y'all don't know who Jay is ICU nurse, been an ICU nurse for some time, going to CRNA school. So my man, Smarty Pants Jay over there, as I like to call him. So shout out to you, sir. Here we go. Question number 6. You are pulled from the ED to the neurologic floor. Which action should you delegate to the nursing assistant when providing care or nursing care for a patient with a spinal cord injury? You want them to assess the patient's respiratory rate every 4 hours, take the patient's vital signs and record them every 4 hours, monitor nutritional status, including calorie counts, or have the patient turn, cough, and deep breathe every 3 hours. What are we thinking? What are we thinking? All right, everybody screaming B at me. Shout out to all 150 of y'all out here. We're on the road to 10,000. On the road to 10,000 likes. So shout out to everybody that's here rocking with me. Another little thing about me, ladies and gentlemen, if you guys are just now joining, I've been a nurse for 3.5 years. I worked ICU, OR, and PACU. I also was in the Navy for 16 years. So I just recently got out in January. So that's just a little bit about me. And of course, I want to know about you, who you are, where you're from, where you're at in your nursing journey. All right. Here we go, ladies and gentlemen. Here we go. Here's our answer in 3, 2, A. Was it AMF? Appreciate the tiny. Was it the tiny diny? Appreciate you. Thank you. It says OR extern. Take that NCLEX. Okay. Shout out to you, Ashley. Let them know how you like the OR. But the answer is B. Take the patient's vital signs and record them every 4 hours. The nursing assistant's training and education includes taking and recording the patient's vital signs. That is part of management of care. Management of care, which is the largest section on the NCLEX exam at 18 to 23%. So shout out to everybody that got that right. Remember, management of care has to do with assignment, delegation, supervision. That's one of the main things that you need to know in regards to the NCLEX. Somebody asked me, it says, I'm the Navy. Were you a medic? Well, if you're in the Navy and you call yourself a medic, I don't know if you're in the Navy. The Navy has hospital corpsmen. We don't have medics. So look at you. Ashley said, I love the OR. All right. I bet you do, though. I bet it says a whole different knowledge in the field. It is. You specialize in knowing peri-operative services. I've worked a little bit in the pre-op, PACU, OR. So I have a good understanding of all that. Army has medics. Yep. Air Force has medics, too. So there you go. Question number 7. You are helping the patient with a spinal cord injury to establish a bladder retaining program. What strategies may stimulate the patient to void? Select all that apply. All right. So I'm going to need to have multiple answers here. CT, ICU, LPN, almost done with RN, going to PACU. Shout out to you, jerk. Shout out to you, sir. Is it stroke the patient's inner thigh? Pull on the patient's pubic hair, initiate intermittent straight catheterization, pour warm water over the perineum, or tap the bladder to stimulate a detrusor muscle. What are we thinking? What do we hate? What do we hate? It says, what are we thinking? Select all. Yeah, I know. Everybody, I don't know anybody that enjoys select all that apply. But one thing I can tell you is that with select all that apply questions now, they're partial credit. They are partial credit. Nayeli says A sounds creepy, right? Oh, so A sounds creepy, but B doesn't? Okay. Okay. Is it Nayeli? So shout out to y'all. Oh my God. Miss G is here. Wow. Ma'am, welcome. Welcome. I appreciate you being here. Here we go, y'all. Here is our answer. It says that's been a lifesaver for me. I bet. Here we go. Here's our answer in 3, 2. And the answer is A, B, D, and E. All of the strategies except straight catheterization may stimulate voiding in a patient with a spinal cord injury. That is part of basic care and comfort. Hey, basic care and comfort actually is part of fundamentals or foundations of nursing, which people don't really remember, right? That all the way back at the beginning of nursing school, right? So basic care and comfort, 6 to 12% on the NCLEX, one of the smaller sections on the client needs, but still very, very much important. So shout out to everybody that got that right. And if you didn't, circle back, make sure you get that content. I'd rather you get it wrong here than get it wrong when you go and take your NCLEX. So shout out to y'all for getting that question. Question number 8, the patient with a cervical spinal cord injury has been placed in a fixed skeletal traction with a halo fixation device. When caring for this patient, the nurse may delegate which actions to the LVN, select all that apply. All right, so it's going to be more than one answer. Now you want to check the patient's skin for pressure from the device, assess the client's neurological status for changes, observe the halo insertion site for signs of infection, or clean the halo site using, the site with hydrogen peroxide. What are we thinking? You missed 4 through 8. Where'd you go? I don't even remember what the last question was. Just like on NCLEX, I done already forgot. A, C, and D. Okay. All right, what are we thinking? Oh, yours froze? You got to get that internet. Samantha, you got to get that internet working better. Shout out to all y'all. We got to 10,000 likes. Hey, we're on the road to 20,000 likes. Make it happen. Hey, smash that like button. Make sure you guys share. Make sure you guys follow. Also, if you're in nursing school right now and you haven't shared this with the people that you're in school with, you are wrong. And I need for you to fix yourself. All right? Don't be greedy. You can't have me all to yourself. All right? It's kind of weird. Share me, which is also kind of weird for me to say. Anyway, so here we go. Here we go. And 3, 2, and the answer is A, C, and D. So checking for signs of pressure is within the LPN scope of practice, as well as signs of infection, and also have the appropriate skills to clean the halo site with hydrogen peroxide, which makes it management of care the largest section on the NCLEX exam at 18 to 23%. Hey, I'm telling you right now, the largest portion of your exam are going to be questions of who do you see first, who can do what, and who can't do what. All right. Management of care will make up a large portion to include it being incorporated with your case studies. OK, so shout out to everybody that got that right. Question number 9. You are preparing a nursing care plan for the patient with a spinal cord injury, including the nursing diagnosis, impaired physical mobility, and self-care deficit. The patient tells you, I don't know why we're doing all this. My life is over. What additional nursing diagnosis takes priority based on this statement? All right. So they have a spinal cord injury, but what takes priority, right? So is it risk for injury related to altered mobility, imbalanced nutrition, less than body requirements, impaired adjustment to spinal cord injury, or poor body image related to immobilization? What are we thinking? I'm late, but I passed my NCLEX thanks to you and your program. Shout out to you, Angie. Hey, Angie, let them know. Let them know down in the comments. Let them know down in the comments. Congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. If there's one piece of advice that you could give to everybody, ma'am, what would it be? What would that advice be for those that are going to go take their NCLEX? And once again, congratulations to you for conquering as official FKK. Ma'am, appreciate all the roses. I appreciate you. 30. Yes, ma'am. I appreciate you. Thank you. The key is in their statement. The key is in their statement. I got you. But here we go. It is C, impaired adjustment to spinal cord injury. The patient's statement indicates impairment of adjustment to the limitations of the injury and indicates the need for additional counseling, teaching, and support. That is part of physiological adaptation. You can also add that to psychosocial integrity, right? Because that's part of good therapeutic communication as well as its safety, right? So you got to think of that. But physiological adaptation, 11 to 17%, and that's the third largest section on the NCLEX exam. So shout out to all of y'all that got that question right. All right, shout out to all y'all. But here we go on to the next one. And here we go. Question number 10. Which patient should be assigned to the traveling nurse new to the neurologic nursing care who has been in the neurological unit for 1 week? All right. So what other group of people would I put this traveling nurse with? Okay. Is it a 34-year-old patient newly diagnosed with multiple sclerosis, a 68-year-old patient with chronic amyotrophic lateral sclerosis or ALS, a 56-year-old patient with, oh my God, I always mess this up. Is it Guillain-Barré syndrome and respiratory distress, or 25-year-old admitted with CA level spinal cord injury? I know somebody's going to correct me on how I said it. I always mess it up. The most stable. Okay, cool. The most stable. It says B. All right, we got B. Shout out to Guillain-Barré is how. Oh, look, I'm already gonna forget that. Gian. I like Gian. Jane. All right, cool. All right, y'all. I'm gonna give y'all 10 more seconds. Everybody's screaming B. Had one person say D. Okay. Jillian Barr or Jillian Bear. I think it's Bear, like pronounced bear. No? Okay. Well, I tried. I'm sorry. All right, y'all. Here we go. Oh, I'm damn, I'm making y'all mad. Oh, Barrett. Jillian Barrett. There's no T in there. It doesn't matter. And our answer is B, a 68-year-old patient with chronic ALS. The traveling nurse is relatively new to the neurologic nursing and should be assigned to patients whose conditions are stable and not complex. That's part of management of care, which is the largest section on the NCLEX exam at 18 to 23%. So shout out to everybody that got that question right. Hey, listen, even if I don't know how to pronounce it, I know what it is. Other people are going to be like, how do you not know that? And I'm like, well, shit, bro. Like, what do you mean? I don't know. Sorry. I'm a nurse. I'm not a damn 11-year-old getting ready for a spelling bee on ESPN. Like, what I look like. But shout out to everybody that got it right. If you got it wrong, you may see this pop up on your NCLEX. You may see it pop up on your NCLEX, all right? So you definitely want to be prepared for that. So make sure you guys go over there and you look up all of those content pieces so you have a better understanding of what you guys are checking out, okay? Here we go. Hey, ladies and gentlemen, I created an ebook. It's over 700 pages to include pharmacology, management of care type questions, EKG interpretation. You want to know why? Because the path to conquering an NCLEX begins with you. I failed my NCLEX, ladies and gentlemen. 3 times, not once, not twice, but 3 times. Shocking, right? See what I did there? Anyways, so I failed my NCLEX 3 times. And you know who's not going to care? Your patient. You know who also is not going to care? The people that are going to hire you. All right? Because the test doesn't determine what type of nurse that you're going to be. Even if you're unsuccessful, turn around, do it again, and keep doing it until it's your time. If you don't put in the work, how do you expect to pass? If you don't put in the work, how do you expect to pass the NCLEX? So get out of your own way, get out of your own head, keep putting in the work, and go back to the drawing board, right? And go and take that test. All right. So shout out to everybody. Hey, if you failed your NCLEX, it's okay. What's not okay is for you to quit, because I don't take quitters around here. Here we go. Question number 11. The patient with multiple sclerosis tells the nursing assistant that after physical therapy, she is too tired to take a bath. What is your priority nursing diagnosis at this time? Is it A, fatigue related to disease state? Activity intolerance due to generalized weakness, impaired physical mobility related to neuromuscular impairment, or is it self-care deficit related to fatigue and neuromuscular weakness? What are we thinking? Shout out to all 112 of y'all out here rocking with me. We are doing NCLEX questions, both for RNs and LPNs. I got them off nurseslabs.com. Free sets of questions. You guys go over there and check that out. Most importantly, I need for you to smash that like button. I need for you to share, and I need for you to follow. I'm almost at 50,000 followers, y'all. I'm almost at 50,000. They got nursing care plans over there at nurseslabs.com, and they will save your life, nursing students. Trust and believe me. All right. It says care plans, pretty much never use them now. Yeah, we don't. It's an obsolete thing, but hey, and still in school, they're gonna drag you. They're gonna make you do the most. All right. But here we go. Cool. And the answer is D, self-care deficit related to fatigue and neuromuscular weakness. At this time, based on the patient statement, the priority is self-care deficit related to fatigue after physical therapy. Fatigue is described as an overwhelming feeling or lassitude or lacks of physical or mental energy that interferes with activities. That's basic care and comfort. Basic care and comfort, which is 6 to 12% on the NCLEX exam. Smaller section, but very much important when it comes to the 8 sections of the client needs. It helps frame your thinking in school. It really does. It really does frame your thinking in school. And it also actually helps you with your critical thinking to make a clinical judgment. Because if I put all these things in front of you, I'm going to ask you, what do you think this patient is displaying? They're going to be like, oh, it could be this, this, this. Okay, cool. So now I know that the gears are turning in that head of yours. Okay, here we go. Question number 12. The LPN LVN under your supervision as the RN is providing nursing care for a patient with GBS. That's that Guillain-Barré's syndrome. What observation would you instruct the LPN LVN to report immediately? Is it complaints of numbness and tingling, facial weakness and difficulty speaking, a rapid heart rate of 102 beats per minute, or shallow respirations and decreased breath sounds? What are we thinking? What are we thinking? Shout out to all 114 of y'all. Also, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here? What are you doing here hanging out with us today here on this Monday? All right, got a bunch of people says D, Colorado. Okay, it's cold up there. Shout out, Colorado is the Mile High City, right? I think that's what it's called. So shout out to y'all that live up in Colorado. Deion Sanders got y'all right, I think. New Jersey. Oh, man. Shout out to Jersey. West Virginia. You take yours on the 13th. Shout out to you, Nikki. You graduate June 24th. Okay. All right. Shout out to y'all. Arizona. Geraldine. Yeah, I remember. Michigan. Shout out to Michigan. All right, Richmond, Virginia. Okay, y'all all over the place. I love it. Here we go. Here's our answer in 3, 2, and the answer is D, shallow respirations and decreased breath sounds. The priority intervention for the patient with GBS are aimed at maintaining adequate respiratory function. These patients are at risk for respiratory failure, which is urgent. Upon presentation, 40% of patients have a respiratory or oropharyngeal weakness. Ventilatory failure with required respiratory support occurs in up to 1/3 of patients at some time during the course of this disease. That's actually part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. It's actually the 4th largest section on the NCLEX exam as well. Hey, management of care, pharmacology, physiological adaptation, and reduction of risk potential make up more than half of the NCLEX exam based off of their categories on where they pull questions from. All right. So just make sure that you guys understand that. Shout out to Jamaica and Haiti. I saw somebody from Nigeria. Right. So shout out to all y'all for being in here, getting your learn on. All right. It says NCLEXers. When did you start studying for it? I take mine in May. Allie, I would recommend you start studying start studying in March. That's when you need to start, because by the time you get your authorization and test and everything comes back, which will probably be like beginning of June, end of May time, you can go jump right in it and you'll have a solid 3 months of studying. So that will be my recommendation. Shout out to North Dakota. Here we go. Question number 13. The nursing assistant reports to you, the RN, that the patient with myasthenia gravis has an elevated temperature of 102.2 degrees Fahrenheit, a heart rate of 120, a blood pressure of 158/94, and was incontinent of urine and stool. What is your best first action at this time? Is it administer acetaminophen suppository, notify the healthcare provider, check vital signs in an hour, or reschedule patient's physical therapy session? What are we thinking? How long after the test do you know if you passed? So, Erica, it depends, because some states you can get them back in 12 hours. Some states you can get them immediately, but on average, it's 48 hours. On average, it's 48 hours. It says, I don't remember a thing about myasthenia gravis, but this seems to be hinting at a classic presentation issue. Shout out to you, Miss Hyper. Miss Hyper, you know what's up. That nursing knowledge never leaves you. It's coming back. Shout out to all 113 of y'all out here rocking with me. We're doing NCLEX questions. Make sure you guys smash that like button. You guys share. You guys follow. We are on the road to 20,000 likes. 20,000 likes. Make sure you guys smash that like button. All right, here we go. Here in West Virginia, we get them back as soon as we walk out after taking it. Yep. In Texas, we have to wait 48 hours. I live in Texas, so we have to wait 48 hours for at least the At least the quick results that you can get. All right. But the answer is B. Notify the physician immediately. The changes that the nursing assistant is reporting are characteristics of myasthenia crisis, which often follows some type of infection. The patient is at risk for inadequate respiratory function. In addition to notifying the physician, the nurse should carefully monitor the patient's respiratory status. The patient may need intubation and mechanical ventilation. That's part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. 11 to 17%. Remember, if you don't understand this, you need to go back. All right. You do the credit card trick. All right. So remember, if these are topics that you don't understand neurologically, right, this is still part of physiological adaptation, and they can pull it. So if you don't understand these neurological disease processes, you need to go back, get the content, keep doing your questions and answers, and keep doing your rationales. That's how you're able to retain the information. Okay. So shout out to all y'all watching from Ghana. I see you. I see you. Here we go. Here we go. It says, I was taught when UAP reports, you have to reassess. So if the UAP reports that to me, of course, I'm going to go and confirm what they're saying. Now, don't read into the question like that. If you read into the question, you're going to get it wrong. Don't read into the question. The UAP was assigned to that patient and they brought those numbers to you. So you as the nurse need to go and you need to see. But you're going to see because they're going to report it to you. You're not just going to blindly take those orders or blindly take those results. You're going to be like, wait, what? Seriously? You're going to go in there, you're going to look, and then you're like, yeah, we got to call the doctor. All right. Here we go. Question 14. You are providing care for a patient with an acute hemorrhage or hemorrhagic stroke. The patient's husband has been reading a lot about strokes and asked why his wife did not receive Alteplase, right? Which is your best response? Your wife was not admitted within the time frame that Alteplase is usually given. This drug is used primarily for patients who experience an acute heart attack. Alteplase dissolves clots and may cause more bleeding into your wife's brain, or your wife has gallbladder surgery just 6 months ago, and this prevents the use of Alteplase. What are we thinking? What are we thinking? Shout out to all 119 of y'all. Appreciate you guys hanging out with me, doing these questions, getting your learn on. Doing these questions and getting your learn on. Everybody's saying C. We got some people saying C. We got some people saying B. You got to think about it. Why is my patient here? And why would we not give her that medication? Or why she did not receive that specific medication? AKA why we did not give it to her. All right, here we go. Here's our answer. Here's our answer in 3, 2, and the answer is C. Alteplase dissolves clots and may cause more bleeding into your wife's brain. It says, Samantha says, because she could bleed. Exactly. Alteplase is a clot buster. All right. With a patient who has experienced a hemorrhagic stroke, there is already bleeding in the brain. A drug like Alteplase could or can worsen the bleeding. That's actually part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 13 to 19%. OK, 13 to 9. A pharmacology is one of those that you will never, ever, 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 ever not know. You have to know it. You have to know it. You have to know it, because the last thing you would ever want to be is in a position to where you don't know a medication, you give it blindly, and then something happens to your patient. Because guess what? It's not going to matter what your hospital's policy is, because the National Council, the board, is going to come for you. All right. So you better know. You better know what your medications are before you give them, and never ever be ashamed to look up a medication if you've never seen it before, or even if you need a reminder. Okay. Question 15. You are supervising a senior nursing student who is caring for a patient with a right hemisphere stroke. Which action by the nursing student or by the nurse student requires that you intervene? So the nursing student is doing something wrong. The nursing student is doing something wrong. So how do we help fix them? The student instructs the patient to sit straight up, resulting in the patient's puzzled expression. Is it B? The student moves the patient's tray to the right side of her overbed tray. Is it C, the student assists the patient with range of motion exercises or passive range of motion exercises? Or is it D, the student combs the left side of the patient's hair when the patient combs only the right side? What are we thinking? Shout out to 117 of y'all. We're on the road to 20,000 likes. Hey, 20,000 likes by question 20. Come on now. Smash that like button. Share, follow. Let's see. Okay. Everybody saying A. We got some people saying A. Leaning towards A. Okay. All right. So, hey, so what are you got to think to yourself, what are those things that are super important when somebody has a right hemisphere stroke? Right? What am I thinking about? Like what can or can they not do? Right? What do they exhibit? It's affecting the left side. Left side's affected. Okay. All right. This is why I like to ask these questions, is because you guys can automatically already tell me the rationale, because watch, rationales will give you, they solidify and help you retain. All right. But here we go. Here's our answer in 3, 2. And the answer is A. The student instructs the patient to sit up straight, resulting in the patient's puzzled expression. Patients with right cerebral hemisphere stroke often present with neglect syndrome. They lean to the left, lean with it, rock with it, and when asked, respond that they believe that they are sitting up straight. They often neglect the left side of their body and ignore food on the left side of their food tray. The nurse would need to remind the student of this phenomenon and discuss the appropriate intervention. That's actually part of management of care, which is the largest section on the NCLEX exam at 18 to 23%. Allie, can you not hear me? Can y'all hear me? Hey, if you can hear me, give me a thumbs up. Shout out to you, Rabbit. If you guys can hear me, give me a thumbs up. Somebody said there's no sound. You can. Samantha can. We can hear you. Shout out to you, Tiffany. I see you. Okay, cool. Awesome. All right. But yeah, so that's part of management of care. Largest section on the NCLEX. I said a thumbs up and you giving me the peace sign. Ma'am. We're not listening. Ladies and gentlemen, check this out. I have an NCLEX course plus a community that everybody can join. Right now, you can join it for a limited time for $7. That includes the 7-day NCLEX course. That includes the new generation NCLEX course that I have in there, plus all the content. Plus, you guys can be a part of the community where I go live. We go through lectures and we go through questions and stuff like that. So make sure you guys go over there and you guys check that out. Hey, that's going to be ending on Wednesday. I'm just letting y'all know that's going to be ending on Wednesday. So make sure you guys check that out, thebootnurse.com/special. And we're going to go over there and we're going to have a good time. I did Monday motivation this morning over there. And it's recorded, pre-recorded. So if you ever jump up in there, you guys can see it. Hey, get you some motivation for the day. All right. Here we go. Question number 16. Which of the following arteries primarily feeds the anterior wall of the heart? Which one? Is it the circumflex artery, the internal mammary artery? Is it the left anterior descending artery or the right coronary artery? Rabbit says, I tried to screenshot so I can remember when we're done. Oh, okay. I'll circle back. You'll see it. I'll circle back. You'll see it. It's on there a few times, so you'll see it. Everybody's telling me C. We got the left side. Okay. Got the left side. Okay. Shout out to y'all. Hey, we're on the road to 20,000. Hey, I need 20,000 likes. Hypersaurus says, absolutely no idea. Haven't needed to know this in years. That's okay, though. That's okay. Ma'am, you already know the deal. I want you to guess. I would rather you guess. You got a 25% chance of getting it right. 25% chance of getting it right. We don't judge here because people are in different levels in their nursing career, right? Some people are just now starting. Some people haven't seen these in years and they have to really guess. They're like, man, I need to probably brush up on that, right? But here we go. Here's our answer. Here is our answer in 3, 2. It says, I'm so helpful right now. It's all good. Yeah, you are helpful. You're handling the chat. I love it. Here we go. And the answer is C, the left anterior descending artery. The left anterior descending artery is the primary source of blood for the anterior wall of the heart. The left anterior descending artery branches off the left coronary artery and supplies blood to the front of the left side of the heart. Physiological adaptation, 11 to 17%, third largest section. All right. Boom. Shout out to you, Jake. I don't know why I said it like that, but shout out to you. But yeah, so remember, if you don't understand this, you got to circle back. You got to get content. You got to keep doing your questions and your answers, and you have to do your rationales. You have to do your rationales. If you don't do your rationales, how are you going to retain the information? All right. There's no tricks of NCLEX. It's called putting in that work. All right. It's called putting in the work. That's exactly what it is. All right. So shout out to y'all that got it right. If you got it wrong, you know what to do. Double boom. All right, here we go. Question 17. When do coronary arteries primarily receive blood flow? Is it during inspiration, during diastole, during expiration, or during systole? What are we thinking? It says kind of crazy you're not at 20,000 likes right now. It's actually kind of crazy, isn't it, Tiff? It's kind of crazy. That should tell you that people, when they really come by here, that, you know, they're just like, oh, yeah. I'll just get free stuff and I'll just leave. They mean to me, I tell you, but it's all good. It's all good. It's TikTok. It's what I expect. What are we thinking? Everybody's screaming D. And here's another thing. Some people are just like, some dude told me he's like, I just took NCLEX and you'll never see a question like this. Let me tell you something right now. A lot of people will say that this is an easy question. If you're getting easy questions, you might want to stop, slow down, and compel yourself, because if you're starting to get easy questions, that means you're possibly not doing so well. The goal on NCLEX is to get to the hard questions. That is the goal of NCLEX. You need to get to the hard questions. So if you start getting to questions that you feel are very, very extremely easy, like what's a normal blood pressure, you might want to think to yourself, hey, slow down, compel myself, read the question, and then dive back into it. Okay. So when people tell you that you'll never see a question like that on NCLEX, they're lying to you, because you just very well might. But the answer is B, during diastole, right? Although the coronary arteries may receive a minute portion of blood during systole, most of the blood flow from the coronary arteries is supplied during diastole. That is part of physiological adaptation, which is the third largest section on the NCLEX exam, at 11 to 17%. If you get a below, you fail it. If you get anything that is not above, it is you didn't pass it. So if you got your NCLEX broken down, like with that, what is it, the CPR, and if it says near, that's not passing. If it says below, that's not passing. If it says above passing, that's passing. If you got your license, it doesn't matter because you passed the whole thing, right? It says, I felt gaslight by everyone saying D. That's okay. No, that's not okay. Don't feel that way. You got to fix that. It says, or you can get it below and still pass. You can, but it depends on how many belows. There's 8 sections. If I got below in one of the client needs, but I killed everything else, it's not going to matter. Oh, okay. So that means you have to get all the above. Correct. You do. But then again, there's 8 sections. Like I just said, it really just depends. But I tell you right now, if you could rock out the top 4 sections, which is management of care, pharmacology, physiological adaptation, and reduction in risk potential, if you can rock those, that's half of the exam. That's more than half of the exam. And all you need is a 50% or higher. That's it. Question 18. Which of the following illnesses is the leading cause of death in the United States? Is it cancer, coronary artery disease, liver failure, or renal failure? You're welcome, Nikki. Everybody screaming B at me. I know you guys were answering. All right, everybody screaming B at me. All right, yes, here we go. I just had this question. Oh, you just had this question? Okay, here we go. No, 60% or higher. No, it's 50%. If I'm coaching you, I'm going to want you to be 60% or higher. Why? Is because you're far away from the 50% mark. That's why. Double boom. Shouldn't it be triple boom now, Jake? Or quadruple boom? I don't know. But anyway, so the answer is B. It's coronary artery disease, which accounts for over 50% of deaths in the United States. Did you guys know what the number one cause of myocardial infarction is? Y'all let me know. What's the number one cause of a myocardial infarction? And that's part of health promotions and maintenance, which is 6 to 12% on the NCLEX. No, you got the last one wrong? Oh, okay. I got you, Jake. No worries. No worries. But shout out to y'all. Hey, remember, if you got it wrong, you got to circle back and you got to get the content. Okay? All right, it's atherosclerosis, blockage, right? Plaque buildup. There's an echo? Oh, is there an echo? I don't know what's going on. My internet is working. Everything is working, right? So you hear an echo? That might be you then. You might want to, like, does anybody else hear an echo? If you hear an echo, let me know. Then I might have to start the live over again. I passed my NCLEX. Yes, that's what I'm talking about. Hold on one second. Who said that? Tasani. Tasani said that she passed her NCLEX. Ladies and gentlemen, you guys already know what to do. Give that lady her love right now. Hey, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. If there's anything that you could say to everybody out here in regards to taking their NCLEX, ma'am, what would it be? And once again, congratulations to you. But here we go. Which of the following conditions most commonly results in CAD? Everybody's saying A. I wonder why. It's probably because I just said it. But anyways, and the answer, of course, is A. What I say, atherosclerosis or plaque formation is the leading cause of coronary artery disease, which will lead to a myocardial infarction. Physiological adaptation, 11 to 17% on the NCLEX, and the third largest section on the NCLEX exam. All right, so shout out to all y'all that got that right. Of course, if you didn't get it right, you know what to do. Geraldine, yes, ma'am. Y'all know what's up. Here we go. Atherosclerosis impedes coronary blood flow by which of the following mechanisms? Is it plaque obstructing the veins, the arteries, blood clots form outside of the vessel walls, or hardening vessels dilate to allow blood to flow through? What are we thinking? Try your best and read the question. Look, let them know. Let them know to RTFQ. Let them know to RTFQ and to read that freaking question, or whatever other F word you want to put there. Shout out to y'all. Y'all got me to 20,000 likes. I love it. I absolutely love it. Hey, I'm just saying, we can do more. I'm just saying. All right. But shout out to all y'all. Here we go. B. Gotcha. Swastika says B. Gotcha. Swastika, you're from Fiji, right? Did I remember that? I think you said you were from Fiji. And ladies and gentlemen, the answer is B. I know that might be kind of hard for you guys to see because it's highlighted. Okay, yes, yeah, I remember that. So the answer is B. Plaque obstructs the arteries. Arteries, not veins, supply the coronary arteries with oxygen and other nutrients. Atherosclerosis is a lipoprotein-driven disease that leads to plaque formation at specific sites of the arterial tree through intimal inflammation, necrosis, fibrosis, and calcification. That's part of physiological adaptation. 11 to 17% on the NCLEX, making it the third largest section on the NCLEX. Swastika, I'm not even gonna lie to you. The reason is because you have a very unique name that around the world, in certain places, you know what it is, and you're just like, wait, is that what her name is? And that's how I remember that you said that you were from Fiji, right? So it's just the name with the location, and I was like, okay, I remember you now. No worries, you good, you Gucci out here. So, ladies and gentlemen, also, hey, if you're one of those individuals that have been having a hard time with the NCLEX, you're nervous, you failed multiple times, you don't know where to start, you don't know how to read anything that comes when it comes to your content in regards to your NCLEX style questions, you're having a hard time understanding NCLEX style questions. Well, I do coaching specifically for the NCLEX. Right. And I've been doing it for the last 3 years. I have a 100% pass rate. If there's anybody that's ever looking for help one-on-one where we break down NCLEX style questions together and we go through calendars, we go through charts, we do a whole bunch of stuff together. Essentially, we kind of hand walk. You guys go over there and check that out, thebootnurse.com/coaching. All right, here we go. Question number 21. Which of the following risk factors for coronary artery disease cannot be corrected? Is it cigarette smoking, diabetes mellitus, hereditary, or hypertension? And yes, you will see hypertension that is also labeled as HPN. Everybody says hereditary. Look at that. Look at that. Y'all so smart. Y'all so smart. Shout out to everybody that's just now jumping in. We're doing NCLEX questions both for RNs and LPNs. I don't know. It depends on certain places, Tiffany. You'll see it. You'll see where it says like, oh, hypertension is also HPN. So on NCLEX, you won't see it that way, but you never know. It depends. Was it hypersaurus? It depends, because when I first saw this question, I was like, what in the world is HPN? And then it says there's another acronym for hypertension, which is weird. So anyway, so the answer is C. It's hereditary, because hereditary refers to our genetic makeup, and that cannot be changed. And it can't. Doesn't matter what you do. You can't change it. You can't change science, ladies and gentlemen. And that's part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. You can stop smoking. Chan, don't tell me what I can and can't do with my life. Okay. Thank you. All right. No, I'm just kidding. But yes, you very You very well can and should stop smoking. There you go. You very well can and should stop smoking because smoking is bad for you. Smoking is like picking your boogers. Yeah, I said it. So all you smokers, you pick your boogers and your nasties. Here we go. Question 22. Exceeding which of the following serum cholesterol levels significantly increases the risk of coronary artery disease? Is it 100 milligrams per deciliter, 150, 175, or 200? What are we thinking? Shout out to all 100 of y'all rocking with me. We're doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. Hey, I need for you guys to like, share, and follow. We're on the road to 30,000 likes. I need 30,000 likes, ladies and gentlemen. 30,000 likes today. Hopefully everybody had a really good weekend. In case you guys don't know me, my name is Kevin. I go by the Boot Nurse on all social media platforms. I've been a nurse for 3.5 years. Worked ICU, OR, PACU. I was in the Navy for 16 years. I failed my NCLEX 3 times and passed on the 4th. And guess what? No part of me cares about what any of y'all think about that because I don't. And no one else is going to care. So if you failed the NCLEX, that's okay. That's okay. Go back to the drawing board and do it again. All right, here we go. Here's our answer. Here is our answer in 3, 2. It says, we love you, Kev. Thank you for doing this. Samantha, you're welcome. I'll keep doing it until people don't want me to do it. And I got 100 people in here that want me to do it. So guess what? I'm still doing it. Here we go. And the answer is D, 200 milligrams per deciliter. Cholesterol levels above 200 milligrams per deciliter are considered excessive. They require dietary restrictions and perhaps medication. Exercise also helps reduce cholesterol levels. The other levels listed are all below the nationally accepted level for cholesterol and carry a lesser risk for CAD. The normal level of serum cholesterol is within 125 to 200 milligrams per deciliter. That is reduction of risk potential 9 to 15% on the NCLEX exam, which is actually the 4th largest section on the NCLEX exam. So shout out to y'all for everybody that got that right. What made the difference for number 4? Honestly, what made the difference was for the fact that I had better time management. I was more accountable. I actually had a study plan, a study schedule. I actually had a nurse mentor who held me accountable. I cut everybody off. I pretty much just had to do everything different that I wasn't doing before. I expected, the definition of insanity is doing the same thing over and over and expecting the same result. And that's exactly what I was doing. Didn't work, so I had to change some stuff. How many times can you fail the NCLEX, or is it until you pass? It depends on your state. It depends on the state that you live in. Question 23, because each state has a limit to how many times you can take it. Which of the following actions is the first priority care for a client exhibiting signs and symptoms of coronary artery disease? Is it decrease anxiety, enhance myocardial oxygenation, administer sublingual nitroglycerin, or educate the client about his symptoms? What are we thinking? Everybody screaming C. Places in like Ohio, you can take it an unlimited amount of times. Just like in New York, you can take it an unlimited amount of times. But in Florida, you can only take it 3 times before you have to take a remediation course, which costs like $2,000 each time. And then they have to fill out like a piece of paper, send it to the board of nursing to say, yeah, this person's good to go. And then you go take it again. Hi, I'm Frida. I don't know if you can see my comment. Yeah, I can see your comment. Nurse Kitty, like Kitty Foreman. Missouri as well. Oh, okay, cool. Damn, it's not B. Okay, Tiff, what is it then? Everybody's telling me C. Oh, Missouri is like that as well. Okay, cool. I didn't know that Missouri was. Wait, are you telling me Missouri is you could take it 3 times and have to remediate? In Texas, you can take it as many times as you need to within a 4-year period. You can take it as many times as you need to within a 4-year period. After 4 years, you have to appeal to the board of nursing. And then the board of nursing is just like, yeah, well, they'll either make you do a remediation course or they'll let you take it again, or they won't even let you take it. They'll tell you to go back to school. All right, here we go. And the answer is B, enhance myocardial oxygenation. Enhancing myocardial oxygenation is always the first priority. When a client exhibits signs and symptoms of cardiac compromise, without adequate oxygen, the myocardium suffers damage. That's very true. It's going to get dark and black, like space. Physiological adaptation, 11 to 17% on the NCLEX, 3rd largest section on the NCLEX exam. Jake, it's okay, my guy. Don't even sweat it. You want to know why? Because you're going to go back and you're going to go read the content. I don't know where you are in your journey. You could already be a nurse, but that's okay if you're getting it wrong. So hey, it's okay. Go back, get the content, get the questions and answers, get those rationales. That's the same way that you got to go around that rotation. Texas is crazy. No, like you can go to You can go to somewhere else. Like you go to Ohio and you can take it as many times as you want. It's unlimited. Missouri is unlimited, which I just found out. New York State is unlimited. So, I mean, 4 years, I think if I give somebody 4 years, that's enough time, in my opinion. Question 24, medical treatment of coronary artery disease include which of the following? Is it a cardiac catheterization, coronary artery bypass surgery, oral medication administration, or percutaneous transluminal coronary angioplasty? What are we thinking? North Carolina? I don't know. I don't live there. So here's what I would recommend, depending on what state that you live in or whatever. Just go to whatever your state's Board of Nursing and then look at their frequently asked questions on how many times you can take it, and it'll have it right there. Look, I only live in Texas, and I can only tell you from specific people that I have coached. Like I've coached people in Florida and in Georgia and in Ohio and in New York and out of California. So I know those because I've coached those people specifically. But North Carolina, I don't know. So it says West Virginia 6 times in 2 years. Okay. So here we go, y'all. Here's our answer in 3, 2, and the answer is C, oral medication administration. Oral medication administration is a non-invasive medical treatment for coronary artery disease. Nitroglycerin is the most common vasodilator used for acute cases of angina. It works to dilate or widen the coronary arteries, increasing blood flow to the heart muscle and to relax the veins, lessening the amount of blood that returns to the heart from the body. This combination of effects decreases the amount of work on the heart. That's part of physiological adaptation, which is 11 to 17% on the NCLEX, and the third largest section in the NCLEX in regard to the 8 client needs sections. So remember that. Remember that, ladies and gentlemen. Hey, you need to know what signs and symptoms are going to be displayed when somebody comes into your emergency department with somebody who has an MI. NSTEMI, STEMI, what's it going to look like on an EKG? You know, we're talking about tombstones, you know what I'm saying? Tombstones, ST elevated, myocardial infarction, says it right there, all right? So we got to remember that. And what steps do we do in order to take care of that patient? All right, North Carolina is unlimited. Are you sure? I mean, I'm not saying that you're lying. I'm just saying, are you sure? I just want to make sure. Question 25, prolonged occlusion of the right coronary artery produces an infarction in which of the following areas of the heart? Is it anterior, apical, inferior, or lateral? What are we thinking? What are we thinking? Shout out to all y'all out here rocking with me. Hey, y'all got me to 25,000 likes. I love it. Hey, let's get to 30. Let's get to 30,000 likes. All right. Hey, I would do it for you. I would sit here and I will watch Attack on Titan and I will hit the screen all day for y'all. All right. I'm just saying. Yeah, they're unlimited. Okay. Tiffany, do you live in North Carolina? I'm assuming since you know so much about it. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is C, inferior, right? The right coronary artery supplies the right ventricle or the inferior portion of the heart. Therefore, prolonged occlusion could produce an infarction in that area. That's part of physiological adaptation, which is 11 to 17% on the NCLEX and the third largest section on the NCLEX exam. No, but I'm a repeat test taker and I take it for, okay. I got you, Tiffany. I got you. I'm picking up what you're putting down. I'm tracking. I got you. Anyways, if you got this question wrong, you know what to do. Hey, if you got it right, you know what to do. Read it anyway. Read it anyway. All right. Just because you got it right doesn't mean you can't learn something else that you didn't know previously about this type of question. All right. So shout out to everybody that got this question right. Here we go. Ladies and gentlemen, if y'all don't know who this young lady is, this is Joy. Joy passed her NCLEX on January 31st. Using the 7-day NCLEX course, which is my course. She liked it. She gave me some really great feedback, as well as she did a testimony, and it's over there it's on YouTube, as well as it's on my TikTok page, and you guys can check that out. Ladies and gentlemen, this lady right here, this young lady right here, that's Crystal. She failed her NCLEX 3 times, right? And she passed on the 4th, working strictly with me in regards for coaching. All right. And when I tell you coaching, this young lady in December reached out to me. I'm telling you right now, if y'all could hear her voice, how she talked to me in December versus how she was going into this exam, and she passed at 150 questions, right? When she took it, I'm telling y'all right now, like she's a whole totally different person. But now that right there, that individual right there, that's Crystal RN, and that very well could be you. So if you're one of those individuals that needs help on passing the NCLEX or you failed multiple times, hey, I got a course and as well as I got coaching. So just saying, that's over there for y'all. But shout out to those 2 young ladies for getting to work, because that's what we do around here. You got to put in the work in order for you to get what you want. All right. So question 26. Which of the following is the most common symptom of myocardial infarction? Is it chest pain, dyspnea, edema, or palpitations? What are we thinking? What are we thinking? Shout out to y'all. Hey, we're almost at 30,000 likes, y'all. We almost there. We almost there. If you guys are new here, welcome. Got these questions off nurseslabs.com. They're free sets of questions. We're doing questions for both RNs and LPNs. The biggest thing, if you're an LPN, you need to know what you can and cannot do and what you can and cannot accept. That's it. That easy. That's exactly what you need to know. You need to know exactly how to do that. All right. So here we go. Here we go. Also, if you're in nursing school, hey, they got some really good care plans over there. You guys can go over there and check out as well. They will save your life. But the answer is A. It is chest pain. The most common symptom of an MI is chest pain resulting from the deprivation of oxygen to the heart. The classic manifestation of ischemia is usually described as heavy chest pressure or squeezing, a burning feeling, or difficulty in breathing. The discomfort or pain often radiates to the left shoulder, neck or arm. Chest pain may be atypical in a few cases. It builds in intensity over time for a few minutes. That's part of physiological adaptation, which is 11 to 17% on the NCLEX exam. 11 to 17% on the NCLEX exam, making it the third largest section. All right. Where do you go for care plans again? Nurseslabs.com. Nurses meaning more than one. Labs meaning more than one. .com meaning the internets. So nurseslabs.com. Atypical presentation more likely in women. Very, very, very true. Very true. All right. Here we go. Question number 27. Which of the following landmarks is the correct one for obtaining an apical pulse? Okay. Which one is it? Oopsie. There we go. I'm sorry. Is it left intercostal space mid axillary line, left fifth intercostal space mid clavicular line, left second intercostal space mid clavicular line, or left seventh intercostal space mid clavicular line? What are we thinking? I know it'd be a lot better if I had pictures, but I don't got no pictures, so I'm sorry. What are we thinking? Shout out to all y'all. Hey, if you guys are new here, welcome. I want to know who you are, where you're from, where you're at in your nursing journey. Working on a lot, ladies and gentlemen, working on a lot. Let's see what we got. Let's see what we got. Here we go. Here's our answer. Here is I saw a lot of people saying C and a lot of people saying B and D. And all right, let's see what we got. Here we go. Here's our answer in 3, 2. And the answer is B, left fifth intercostal space mid-clavicular line. The correct landmark for obtaining an apical pulse is the left intercostal space in the mid-clavicular line. This is the point of maximum impulse and the location of the left ventricular apex. That is physiological adaptation, which is the third largest section on the NCLEX, which is 11 to 17%. So shout out to y'all. Shout out to all of y'all. Carolina, you passed your NCLEX. Yes, that's what I'm talking about. Hey, you're like number 3 or 4 to come in here today and tell me about you passed your NCLEX, Carolina. I'm proud of you. If y'all don't know Carolina, she was a frequent flyer that was in here. I remember. So shout out to you, Carolina, for passing your NCLEX. All right. Welcome to the greatest shit show on earth known as being a nurse. I'm very proud of you. If there's one piece of advice that you could give to everybody here when it comes to taking the NCLEX, ma'am, what would that be? Once again, congratulations to you. All right, let me see what somebody said. Is it harder to pass NCLEX if you do a B? No, it's not, because I was in an accelerated. Your NCLEX has nothing to do with if it's an accelerated or traditional, because you're going to get the same content. It's just the accelerated. You're just going to get it faster. All right, here we go. Question 28. Which of the following systems is the most likely origin of pain the client describes as knife-like chest pain that increases in intensity with inspiration? Is it cardiac, gastrointestinal, musculoskeletal, or pulmonary? What are we thinking? What are we thinking? Tiffany's telling me C. Everybody's telling me. You got some other people saying D. Ebony's saying C. Okay. Swastika says A. Swastika, I gotta know. Do people make fun of your name? Maybe it's just like a United States thing because of what a swastika is here. Do people make fun of your name? I gotta know. And I'm not saying this in a rude way. I just got it because your name is swastika, and I've never seen anybody name that. So now I'm genuinely curious. And if they have, let me know and I'll fight them. Intent on inspiration. Okay. A is usually crushed. Okay. All right. I'll give y'all 10 more seconds. Got A and we got D. All right. Shout out to all 98 of y'all that are out here answering. What else we got? Caramel says D. Okay, here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is D. It is pulmonary. Pulmonary pain is generally described by these symptoms. Pain may originate from several different structures within the chest, including the skin, ribs, intercostal muscles, pleura. Hold on one second. Pleura. Esophagus, heart, aorta, diaphragm, or thoracic vertebrae. The pain may be transmitted by intercostal, sympathetic, vagus, or phrenic nerve. The innervation of the deep structure of the thorax follow common pathways to the central nervous system, making it difficult to localize the source of pain. Once again, physiological adaptation, third largest section on the NCLEX at 11 to 17%. Jake says, boom. Shout out to you, Jake. Shout out to you. All right. Swastika, you said no. Okay, cool. I just had to know because I'll fight for you. I don't like people doing that. I'm just saying. But shout out to you, Miss Ma'am. Tiffany, what'd you say? You said, I was thinking that it was actual. See, look, you've got to read the question, ma'am. You got to read the question. You know better. You've been here long enough. Question 29. A murmur is heard at the second left intercostal space along the left sternal border. Which valve area is this? Is it aortic, mitral, pulmonic, or tricuspid? What are we thinking? Shout out to all 105 of y'all out here rocking with me. We're doing NCLEX questions for both RNs and LPNs. Make sure you guys get this for yourself. They're free sets of questions. You guys can go over there to nurseslabs.com and check those out for yourself. All right. Man, y'all got me all the way to 30,000 likes. I appreciate you. Hey, keep smashing that like button. All physicians enjoy taking money. Of course they do. Of course they do. What physician doesn't? Because hey, we know time is money, right? That's the old, how the old saying goes. Time is money, right? Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is C. It's pulmonic. Abnormalities of the pulmonic valve are auscultated at the second left intercostal space along the left sternal border. Murmurs of the cardiac system develop due to alterations in blood flow or mechanical operation. Murmurs develop from a multitude of mechanisms. Typical cases include low blood viscosity from anemia, septal defects, failure of the ductus arteriosus to close in newborns, excessive hydrostatic pressure on cardiac valves causing valve failure, with a hypertrophic obstructive cardiomyopathy and valvular specific pathologies. That's part of physiological adaptation, which is the third largest section on the NCLEX at what? 11 to 17%. So shout out to y'all. Oh, so that's why you said, oh, the physicians like money. I never even heard of it. I never heard of that. I don't even remember that one specifically, but man, that flew like right over my head. That flew right over my head. All right. Did I do accelerated? Yeah, I did an accelerated BSN program and it was 18 months. A couple of my other friends did an accelerated BSN program in Arlington, the UT in Arlington, and that one was 15 months. So it can work. You can do it, or else they wouldn't be there and they wouldn't work. Here we go. Question number 30. Which of the following blood tests is most indicative of cardiac damage? Is it a lactate? Was it a dihydrogenase? A complete blood count? Troponin 1 or troponin I or creatinine kinase? What are we thinking? Or kinase? Or kinase? What are we thinking? Troponin. Everybody's telling me C. Okay. All right. I had troponin checked a week ago, so I know firsthand. Okay, Samantha. Hey, so here's the thing. Sometimes personal experiences can really tell you the answer. I remember anytime someone came in for chest pain, I did trope and EKG stat. You know what's up. Anaerobic metabolism. Okay. Oh, hypersaurus. You smart. You smart, Miss Lady. You know what's up. All right, y'all. 10 more seconds. 10 more seconds. Hey, after I do these questions, I'm going to do a quick little Ask Me Anything. You guys can hang out. And you guys can ask me stuff about nursing, about NCLEX, about whatever. So do you have a degree in something else to be in? No, you don't. You don't have to have a degree in something else in order to get into a BSN, an accelerated BSN. You could just apply for it just like you would apply for any other program. All right, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is troponin. Troponin 1 levels rapidly, or say rise rapidly and are detectable within 1 hour of myocardial injury. Troponin 1 levels aren't detectable in people without cardiac injury. The troponin complex consists of 3 subunits: troponin C, or it's troponin C, troponin I, and troponin T, and is located in the myofibrillar thin, filament and of striate muscles. There you go. I almost messed that up, but y'all know what's up. Reduction of risk potential, 9 to 15% on the NCLEX exam. 9 to 15%, making it the 4th section on the NCLEX exam. What program did you do? I'm considering going accelerated pack. You got a lot of questions. And I don't feel like answering you right now. How about that? No, I'm just playing. I went to Texas A&M. I promise I'm not this aggressive, but I went to Texas A&M in Corpus Christi. But you could look at other ones like, you could look at other programs like freaking Western Governors University, Capella, Grand Canyon University. They have so many accelerator programs now. It just depends on which one you want to do. And of course, ladies and gentlemen, hey, if you missed it, hey, go get you that free download, right? Go get you that free download, thebootnurse.com/test. Hey, if you're looking for an ebook that's over 700 pages with all the important things that you need to know, I kind of went overkill, but I would rather you have it than not. thebootnurse.com/victory. Hey, if you're looking to join and get an NCLEX course, you can join it right now for $7. It's on a subscription base. Once it goes from $7, it goes to $48. $48 a month, get you that NCLEX review, as well as you can jump into the community where we're going to be doing conversations, doing lectures and stuff in there as well. And then, of course, if you are looking to do one-on-one where you get to sit here and look at my gorgeous face, just kidding. But if you want to work one-on-one with me for me to get you through NCLEX, hey, check me out, bootnurse.com/coaching. And ladies and gentlemen, that wraps up the questions for today. I was scared and went to church. Oh no. That's not funny. That's not funny, but you are RN. Look at that. You see what I'm saying? Sienna, you know what I'm saying? First try. That's what I'm talking about. I'm glad that you did it on your first try, but there's nothing different for how I feel towards people that pass it on the first time versus if they pass it multiple times. But there are people that when you pass it on multiple times, I hold that near and dear to my heart because I was one of those people. So Jake, I appreciate you. Thank you for being here. I appreciate everybody participating. Y'all got me to 30,000 likes. Has anyone on here purchased the 7-day NCLEX course? So who was in here that purchased it? There were a few people that purchased it. And you can also check my oh my God, what is it? You can check my my TikTok. You can check my TikTok on there as well. And for the people that have purchased it. But the 7-day NCLEX course and the community, you can join it for $7. You can join it for $7, right? It is no longer for a lifetime access. It's under a subscription base, but it's for $7 to start you off. And then it goes up to $48 a month. So, but if that's not something that you want, that's cool. You can go check out that free download, or you can get the ebook. Also, if you're looking for coaching, once again, you guys can check that out. I'm going to message you, Tiffany. Yeah, message her. Because Tiffany tells me, she's like, Kevin, I'm about to go back to studying. All right, cool. Do your thing. All right, y'all. Here we go. I'm going to turn this thing around. Hey, don't talk about my eyes, okay? I'm getting allergied out up here. You know what I'm saying? But hey, shout out to all 68 of y'all out here rocking with me. I appreciate you guys getting me to 30,000 likes. I appreciate you. It says, do you have a new nurse bundle, like how to chart? I don't. So I only specifically do stuff for NCLEX, at least right now. I'm only doing one thing at a time, and I'm doing the one thing that I love, and that is getting people to pass that NCLEX. One of the best nurses, on my unit sat for the NCLEX 5 times. And I bet you, Allie, you probably didn't even know it until like way down the line. I bet you didn't even know it until way down the line, right? So what's included? So what's included right now with the 7-day NCLEX course is that you get each section of the NCLEX test plan that's broken up. So management of care, physiological adaptation, those are broken up. And I go through like 30 questions to include case studies. Then you get another review for the new generation NCLEX review where I go over 100 questions, tips on how to study, memorization tricks, and all that stuff. And then you get content. And I update content like on a monthly basis because I do all the recording. I have my content, I have all this stuff, and I have to record, edit, stuff like that, and all that stuff goes up there. So as of right now, there are 60 plus videos that are in there, and you're getting it for $7 when you start, and then for $48 a month. So that's all the stuff that you get in there. Plus you get to be a part of the community where I go live. I did Motivational Monday today, and then on Wednesday I'm going to be doing what I call Content Cafe, and I'm going to be going through lectures. I'm going to pick a lecture and we're going to go through it. An important lecture that you need to know for NCLEX. All right. What else we got? Definitely recommend. Shout out to you, Angie. I had no clue until she told me after work. Oh, look at that. That's what I'm saying. That's what I'm saying. Geraldine, you're very welcome. 2 thumbs up. I appreciate you. So what questions do you guys have in regards to nursing, in regards to NCLEX? You know, like somebody was asking about a first year bundle, like, you know, the things that you need to know and be prepared for. What questions do you guys have? I'm going to hang out here for a couple of minutes, see what questions you guys have. And that's the thing. And Ali, I'm gonna kind of like I'm gonna circle back on you, and that's what I try to tell people, that the NCLEX does not determine the type of nurse that you're going to be. You'll see some of the greatest nurses out here that have passed it, that have taken it multiple times, and you'll see some terrible nurses that, you know, obviously have lost their empathy to become a nurse, and they pass on the first time and they're terrible. I've seen first-time nurses, or I've seen new grad nurses that pass the exam the first time become terrible nurses, have horrible medication administration, you name it. You know what I'm saying? So, like I said, the test doesn't necessarily determine what type of nurse that you're going to be. Only you can do that. Julie, it says, had my nurse tech orientation. Okay. Coming back when I take the NCLEX from your course. Yes, ma'am. You better come back and let us know how you did. All right. So shout out to you. How was your nurse tech orientation? Because now you're getting familiar about like everything that's going on within the hospital. All right. What are we thinking? What are we thinking? I'm going to hang out here for about, another like 10 minutes. But if you guys don't have any questions, ask away. If you guys are just now joining, we just finished doing NCLEX questions for both RN and LPNs. You guys can check those out. You guys can definitely check those out over at nurseslabs.com. They are helpful, especially if you're in nursing school. When you're trying to, get your care plans, they have those over there as well. So whatever question you guys have in regards to NCLEX or regards to, nursing in general, ask away. It was good. I thought about you getting hyped to start the program this fall. Julie, by the time you start the program, there's going to be plenty more that's going to be in there. All right. You graduate soon. Is it Valerma? I feel like it's Valerma. So shout out to you for graduating. Hey, for those that are going to be graduating in May, that's right around the corner. Look, hey, we're more than halfway through February. Do all nurses have to do the 4 years? What do you mean, Angela? What do you mean? Oh, heck. It says, oh, heck yeah. Wait, you have stuff to help with nursing school, like courses. So the stuff that I go over inside of the course, you're going to learn in nursing school. Like if I talk about atrial fibrillation and atrial flutter, VTAC, VFib, EKG interpretations, deep vein thrombosis, therapeutic communication, safety, like all that stuff that you're going to learn in school, those are pertinent things that are going to be on the NCLEX. So those type of things are going to be in there. 4 years of schooling, no. So it all just depends, because everybody has a different journey on how they get there to their exam. So like for me, it took me 8 years to become a nurse, because I was in the Navy. I was transferring from place to place. And I had to go to multiple different schools because I had to move. And then I eventually got into a nursing school, passed it, took me 4 times to get my license, which was over 2 years. And so it all just depends. It really just depends. But you could most definitely go, if hindsight's 2020, if I could go back and do it all over again, I would go to an associate's degree nursing program, do it for 2 years, get out, start working as an RN, because an ADN program and a BSN RN program are the same nurse. Like you take the same licensing exam. And then I would literally be working as a nurse, and then I would be doing online BSN classes. And then, I would have just acquired the degree rather than, acquire the degree and then have to study for NCLEX again. Don't have to do it. All right. So, or, just depends on, financially what you need to do for yourself. Like you can't afford to go to a 2-year program, or you can't go to a 4-year program. That's fine. Like maybe you need to be an LPN. Maybe you need to go to LPN route to become a nurse because, you know, it's a little bit cheaper, and that's okay. Never let anybody downplay your journey. Don't let them down. Like if your journey is going backwards, that's different. But if your journey is going forwards and you have to take it in baby steps, like going to become a CNA to see if you even like medicine, any aspect. If you like listen, I heard somebody say like, yo, if you're go straight to getting your bachelor's, like thank me later. I was like, well, maybe for you, but it's not like that for everybody else. Maybe you'll get into medicine and you're just like, nah, I don't want, you get a little bit of it. Like, I don't want no part of that. Go be a CNA. There's nothing wrong with that. The pay is not the greatest, but if you want to understand what it's like to work in a hospital and to have, you know, a foot in the medical field, there you go. And then if you want to work your way up, go do that. You very well can do that. I never understood how somebody can project their own thoughts onto somebody else to tell them what to do in order for them to get there. Now, here's the thing. I always tell you like, hey, there's multiple ways for you to get there. I always suggest. There's a difference between me telling you what to do versus what I suggest for you to do, because in the end, you're going to make your decision. Medicine is not everybody's cup of tea. CNAs don't work in the hospital. What? They climb the ladder. CNAs don't work in the hospital, but climbing the ladder, they make the best nurses. Oh, yeah, for sure. I was like, what do you mean they don't work in the hospital? I was like, we have CNAs that work in the hospital. I don't know what hospital you work in, but we have CNAs that work in ours. Or I'm sorry. We call them patient care techs. You know, it's still same concept, but patient care techs, unlicensed assisted personnel, whatever. Doesn't matter. Still the same. So, but for sure, most people that are at the bottom, like me, I was in the Navy. I started at the very, very bottom, you know, wiping ass. Then I became an EMT, worked in the emergency department, did that for a little bit. Then I became a surgical tech. Then after a surgical tech, I became a surgical tech instructor. I was still working as a surgical tech. Then I went to nursing school. So by the time I became a nurse, I'm not saying that you couldn't tell me anything, but it's about the fact that I knew that I was going to be a great nurse. I just had to get over those humps of going to school. You know what I mean? It says now CNAs and nursing homes get dirty work, load way heavier. Oh no, I don't disagree about the load. I know those CNAs that work in nursing homes. Oh, I know they get the business, like 40 to 60 patients, which is absolutely asinine. I know that's crazy. And I'm not discounting nobody when they come into putting in that work, because I can tell you right now, I worked ICU and I never had a tech. I never had nobody. And then when the one day that I got one, it was like the heavens opened up. I was like, yo, shout out to you. I'm glad that you're here. I love you. Appreciate it. It says, hi. So I tried to sign up and you're sold out. What are you talking about, Jamie? What are we talking about? Sold out of what? It says, but make great nurses. I was one. They understand the facts. They do understand the frustration, because you see it from the lowest level. What type of homework do you have in nursing school? Lots of it. You have all different types of homework. For a phone call? Oh, so Jamie, I don't know. You might have to send me. A message. You might have to send me a message, because in order to schedule a phone call, you have to fill out the questionnaire. And I'm pretty sure, I think that was you that came across. Let me see. Yeah, I see your stuff right there. So I'll go and I'll check that out. You should have got an email that had the link for you to go and schedule a phone call. Okay, I did that. Okay. So yeah, you should have got an email for you to go schedule that phone call, and it should have took you over there in order for you to take care of that. What type of homework? Okay, I already answered that question. Like you get all different types of homework. Like you get a lot. Everything from care plans to studying for, you know, pathophysiology, pharmacology, you know, med surg, OBGYN, pediatrics, psych. If you're in a BSN program, they'll add research. Like it all just depends. You got a lot. There's a lot you got to study for. I did, and it says you're sold out and I don't see April schedule. Okay. After I get off this live, I'm going to look, and then I'll email you. And then I'll see what's going on. That shouldn't be that way, because I was actually on there like yesterday to make sure that everything was good. It could be something else, but we'll check. I will check that out for you. But shout out to everybody that's just now joining. We went over NCLEX questions. We did about 30 of them. Got them off of nurseslabs.com. Make sure you guys go over there and check that out. Of course, make sure you guys go check out thebootnurse.com. By the way, I'm writing a book. Yeah, that's right. I'm writing a book, and it's coming out. It's coming out soon. I'm waiting on my my book cover and my concept to come out, which hopefully should have been today. So I'm hoping it'll be out by it'll be done by Wednesday, and then I'm gonna talk about it. I'm gonna post it up, and we're gonna start doing pre-orders for it. And then I'm also gonna open up a TikTok shop when it's done. When it's done. And everybody that orders from the TikTok shop will get a autographed copy from me. So you guys will find my John Hancock inside of there, right? And then think about putting in some other things in there as well. But yep, it's coming. The book is coming. The book is coming. So shout out to everybody that's always been here, that's always, looking to support. It's going to be about NCLEX. However, it's going to talk about the journey to NCLEX. It's all about perseverance. It's all about motivation, and it's all about getting y'all over that hump. I feel like if I tell my story, it'll help resonate with you in order to get you over that hump for you to get this license. So many people fail it, or they're so nervous to take it that they won't take it. Like some people are like, I was too nervous and I couldn't take it. And I was like, so you wasted all that time in school? Or you took it once and you haven't gone back in years. And I was like, so do you not want to be a nurse? You don't want to be a nurse. Apparently you don't want to be a nurse that bad, right? You just did it. You just went through all that shit in school just because, So what I'm saying to y'all is that this book is going to be about getting to work and getting the job done, because we don't quit around here. We don't quit. And I don't want y'all to quit. I don't ever want nobody to quit. It doesn't matter what it is. Nursing is just the catalyst. That's the beginning. I don't ever want you to quit on something that to be true, and that's going to be great for you. All right. Sharonda, any suggestions how to study for the entrance HESI? I failed, and that test was crazy, LP and RN. So Sharonda, I don't do anything specific for HESI or even ATI. However, I can recommend the Yellow Mometrics book. In my opinion, I used the Yellow Mometrics book, and I used another one. It was the Trivium. And I studied for like a month, and it worked for me. And I got like I don't know what I got. I scored really high. It was like 1,000. I guess really high. It was like 1,000 or something like that when I took it. And that worked for me. And that very well can work for you. Or you can check out my homegirl. Her name is Sam, the Nurse Sam. You type it in, it's all one word, the Nurse Sam, and you'll see her. She'll it'll look like my picture, but it'll have like a pink background, and she'll have on pink scrubs, and she does ATITs and HESI A2 like question based like I do. She does them every Tuesday, so make sure to go follow her, because she's gonna do them tomorrow. She does them like Jeopardy style, so go over there and check those out for sure. Because ATI, I remember I go to her lives and I look at them and I was like, bro, I don't remember none of that. I don't remember none of that, because none of that is important. Like none of that, like you're not even going to remember none of that when you're in nursing school, because it's not going to mean anything. And I'm sorry, but it's the truth. But those entrance exams are there to keep people out. All they do is they just keep putting up walls to keep people out, because they know people are going to fail. I've been out of school for 10 years. That's okay. There's nothing wrong with that. Guess what? You're just going to have to relearn just like everybody else. Relearn just like everybody else. But shout out to all 20 of you guys and gals that are still rocking with me. Hey, we did NCLEX questions. If you have not followed me, make sure that you guys follow me, because I do questions every Monday, Wednesday, Friday at 5:30. And I get those questions from nurseslabs.com. I'm actually going to start pulling them from other places, scouring the internet for them. So make sure you guys are liking, and make sure you guys follow so you guys can be a part of that. Hopefully I'm at 50,000 likes right now. 50,000 followers. Let's see. Oh, I'm at 49.9 thousand followers. I thought I would have got to 50K today. Yeah, man, that's all right, because I was going to give away a month free of the 7-day NCLEX course when we got to 50K, but that didn't happen. That didn't happen today. So I guess we'll just try on Wednesday. So, it says, I don't know half of that. That's okay. Like when I started like practicing for the HESI, Look, it was like starting all over, and I had a headache, and I was like, this is dumb. I already have an associate's degree. Can I just like not do that? But they do that on purpose to keep people out. For sure. They do it to keep people out. All right. So what other questions do you guys have? What other questions do you guys have before I wrap this up? All right. Maybe I should start putting music on. I think I'm going to do an outro music song. And I think I know the perfect one. I think I might start doing it on Wednesday. I just have to find it. So, but anyways, ladies and gentlemen, I appreciate everybody being here for doing NCLEX questions today here on this Monday. If you have not checked out the 7-day NCLEX course, make sure you guys check that out. That link is in my bio, as well as there's a free download over there and an ebook. If you're looking for coaching or anything, shout out to you, Grace. Hey, Grace, Nurse Meg, she follows me now. And I think she sent me a message. I got to look at that. But I like her stuff, by the way. I like her stuff. But Grace, I love how you're all over the place. I love how you're all over the place. So you're going to do extremely well when it comes to that NCLEX. I have no doubt. So, but anyways, make sure you guys go check out the 7-day NCLEX course, and you guys check out everything that I have going on. Make sure you follow me on YouTube as well as Instagram. And make sure you guys come back on Wednesday. Come back on Wednesday. All right. Last thing is to be kind to yourself. Be kind to yourself. You only got one person. You only got one you. If you can't take care of you, you can't take care of nobody else. Point blank, period. You can't take care of no spouse, no kids, no nobody. Right. So you. All right. And if you are taking the NCLEX or if you failed it, get out of your own way. Get off of your beach. Stop being scared. If you're scared, go to church. Guess what? You're going to do it, and you're going to do it scared, and you're going to do it anyway. That's the only way that we learn. That's the only way that we get better. All right. So once again, shout out to all y'all that were here rocking with me today. I will see everybody on Wednesday.